All right, great. Good afternoon, everyone. Let me just thank you guys for being with us today. Just wanted to start with a few opening comments, and then we'll take a few questions. First of all, just want to make sure to remind everybody that I am fully vaccinated and now fully boosted, and I want to continue to urge all Georgians to talk to their doctor about the benefits of getting the life-saving vaccine or receiving their booster shot. We're encouraged by the data demonstrating that when you're vaccinated and boosted, you have great protection against the virus and symptoms are more likely to be mild. 60% of Georgians have now had at least one dose, 53% of Georgians are fully vaccinated, and 30% of those fully vaccinated are also now boosted. I believe it's time to trust our citizens to do what is right for themselves and for their families, and we will continue to do that. That being said, I will not be implementing any measures that shutter businesses or divide the vaccinated from the unvaccinated or the masked from the unmasked. I've also been in constant communication with hospital leadership to help fulfill their needs. This morning I spoke to 9 different health systems from around the state. They are obviously being inundated with people who need to be tested but are not experiencing severe symptoms. To keep emergency room and hospital resources available to the individuals who have the most critical health needs, we're urging Georgians to do their COVID-19 testing at primary care locations, public health sites, or use reliable at-home testing kits. The Georgia Department of Public Health is actively working to increase testing capabilities. Dr. Toomey was on the bigger call we had this morning and alluded to that and other things, and we will be doing everything that we can to support them in this effort. Currently, DPH is also working to secure a new testing site in the metro Atlanta area near the airport. They're also expanding staff at the district test sites as well. To further support the needs of the medical community, we will be putting $100 million toward healthcare staff augmentation across the state. This could mean up to 1,000 additional personnel. As of right now, their assignments will be effective for 13 weeks. Additionally, if you'll remember, in August, we authorized up to 2,500 National Guard troops for times such as this. We are beginning to identify their assignments. We will be deploying approximately 200 troops starting January the 3rd. Approximately 96 of those to support Department of Public Health, including testing sites, and approximately 100 will be going to hospitals. We are planning and we will begin mobilizing by next week. We'll also be operating at capacity and fulfilling assignments by January the 18th. In closing, I just want to continue to reassure my fellow Georgians, we've gotten through this before. We'll absolutely do it again. We're all in this together. We will work diligently to provide aid and cut down on people's wait times at testing locations, but we want to urge Georgians to be patient and be compassionate to your fellow neighbors and citizens. Thank you. Stay healthy, stay safe, and God bless. With that, we'll take a few questions.
Governor, when you talked to those hospital leaders this morning, what was the number one concern that they had, the number one ask they gave for you?
Well, I think on the messaging side of things, the number one ask for them was just to tell people don't come to the emergency room to get tested. I mean, look, obviously if people are sick, if they're not feeling well, if that is their only option, they absolutely need to go to the emergency room. But if people are just simply needing a test, with the amount of hospital staff that's now getting this very rapidly spreading virus that can't work, they're short staffed as is with the increased volume that they had prior to the COVID numbers popping back up, which every hospital was basically full and at full capacity doing elective surgeries and other normal business in the ERs. They are just asking people, it would be helpful to them not to go to the hospital to get a test if you have another option, like a public health site and other things. And we talked to some of the rural systems today about getting ahead of that, knowing that that's going to be an issue for them. This obviously, unlike the last wave with Delta, if you remember, it started in, really in Florida and moved up. This has started more in the metro area, and we expect to go, south and north. So we're giving the rural systems a heads up. The biggest thing that they're experiencing, though, inside the hospital is just a staffing issue. Just with the volume that's out there, obviously this is happening all over the country. all at the same time. So every state, every hospital for the most part is dealing with this issue, and everybody has people that have gotten coronavirus and they can't go to work. May have very mild symptoms, but they still are unable to work without quarantining for several days. So that's short-staffed the hospitals. That's why we're doing the augmented staffing again. And this will be a challenge really across the country over the next 2 or 3 weeks. But as fast as this is moving, hopefully this will be a shorter lifespan than what we've seen in the past. But look, we'll ride it out, fight, and support as long as we need to.
Are the people out there for you to hire? You've got that $100 million to spend. Are there people there you can get into these hospitals quickly?
Well, I asked that same question, and our team feels very confident that they can get the resources that they need to support our hospitals. We've had a proven track record of doing that in the past with some very good vendors, so our team's very confident that we can fulfill that mission.
Governor Kemp, we know that the testing sites are also experiencing very long lines. Are there plans in place to maybe partner with the local county health departments for the troops to come help with testing as well?
Well, I'll let Dr. Toomey speak to that specifically. I know she's not here with me, but we'll be glad to get her any questions that she can follow up with. She's kind of running point on what the public health response is to the testing facilities. Like I said, on the state side, we're ramping up. I know that the counties probably are too. But I would just urge people to be patient. I mean, the demand that we're seeing now is unprecedented, not just in Georgia, but all across the country, but just because this virus is spreading so quickly. The good news is early indications are if you're vaccinated and boosted that you have good protection and it will be milder than what the Delta variant was. I don't want to speak too much to that because I haven't been reading every medical report that's out there. But it is spreading a lot quicker than anything we've seen. I mean, you can just simply look at the numbers. So we realize testing sites are going to get overwhelmed. That's why we want people to be patient. We're doing everything that we can with the resources that we have, people, number one, and testing supplies to fulfill the needs, and we will continue to do so.
Governor, what is the next strategy for increasing vaccination rates? Are you considering other incentives? What does your office do moving forward? Well,
I think at this point I'm trusting people to do what they feel is best for them. I mean, I think badgering from the government, especially when you think about the federal response that we've had from President Biden, literally saying that he was going to unify the country and we were not going to have vaccine mandates. Well, now we have a mandate. You heard his remarks the other day throwing things back at the states after, just a few weeks ago he was telling the governors to get out of the way. What people can count on in Georgia is we're going to continue to have consistent leadership where we're talking to our medical professionals like I did today, talking to 9 different healthcare CEOs or their representatives, continuing to stay in touch with Dr. Toomey and her office on all the different responses that we got that's going on testing and a lot of other things that we're doing. And we're just going to throw every resource we have. But at this point, people have been so confused by the government. The last thing I think we need is government politicians and leaders, especially in Washington, confusing them even more or even trying to convince people. My message has been very consistent for months and months and months now. Talk to your doctor. Talk to your local pharmacists that you support. Make a good health care decision for you and your family. I mean, we have to trust people to do that. You've seen our business community and our small business owners are doing the same thing. You got some people that are closing down. Some people are fighting through it. We have to trust people. And we have a lot of tools to fight this virus with now. We have to trust people to use every tool available to take care of, their business, their family, their staff, and their customers. And that's what we've been doing in Georgia for a long time.
All right. Thank you all so much. We appreciate you coming out.
Thank you.